Hello everyone, this is a video on clinical demonstrations of complete denture, part 6, delivery of denture. These are the instruments and materials that you need to prepare for the visit. After receiving the denture from lab, check the denture by running your fingertip on the denture integral surface to ensure no acrylic pearls or roughness is present. Run a gauze over the integral surface of denture. If there's acrylic pearls present, you may find snagging of the gauze. Same goes to the maxillary denture. If there is roughness, use the wax knife to remove or trim it with acrylic burr. If you have done it, insert the denture into patient's mouth. This is the checklist during the delivery denture. Check stability of the denture by alternating pressing on right and left occlusal surfaces of premolar. Check the retention by pulling out the denture at the canine region. This is to assess the peripheral seal. Manipulate the buccal and the labial soft tissues to simulate oral musculature in function. If denture border is overextended, movement of oral musculature can displace the denture. Instruct the patient gently moves his tongue back and forth and to the left and right. In this case, you can see the denture is lifted when the tongue moves. Take note of the overextended areas which deems to be trimmed later. Trim the overextended area with a slow-speed acrylic burr. Alternatively, you can detect overextended denture border by using a pressure indicating paste. Mix the paste according to the manufacturer's guideline and apply on the integral surface of the denture. Place the denture in patient's mouth and gently manipulate the buccal and labial soft tissues to simulate oral musculature in function. Then ask patient gently moves the tongue to the right and left. After the paste is set, remove it from the patient's mouth and examine. The paste will be displaced if the denture flange is overextended. Use an indelible pencil to mark the overextended area. Trim the overextended area according to the marking using slow-speed acrylic burr. After you have checked the mandibular denture, do the same for the maxillary denture. Check the stability and the retention. Check the overextended flange by removing and reinserting the denture. The overextended flange will push the sulcus away. Mark with an indelible pencil to indicate area of relief needed. Now you trim the overextended area according to the marking using a slow-speed acrylic burr. Check the orientations of the occlusal plane with a Fox occlusal plane and a ruler. The horizontal plane should be parallel to the interpapillary line. Check if the sagittal plane is parallel to the alatragal line on both sides. The following steps is to verify the OVD of the denture. Insert both dentures inside the mouth and measure the OVD with Willis gauge. Your OVD should be similar to the OVD recorded during the trial visit. The next step is to check occlusion of the dentures. Hold the mandible dentures firmly on the ridge and guide the patient to close his mouth at centric relation. Dry the teeth surfaces before checking with an articulating paper to retain the stain. We aim to have a balanced occlusion in this complete denture case. After checking with the articulating paper, remove the denture and check the marks on denture's occlusal surface. Note the occlusal surface with heavy spot indicating a premature heavy contact. Trim the heavy contact area with a slow-speed acrylic burr. Place the denture back into patient's mouth and check again with articulating paper. Now there is heavy contact on 14, 15 and 45. However, the contacts are same on the left posteriors. The heavy contacts are trimmed. After checking the static occlusions, lateral excursions is checked. Ask patients to move the mandible to right and left. Note the interfering contact that hinders smooth excursion. If the denture is lifted from reach, stabilize the denture with your hand while asking patients to move the mandible. Here, we can see only tooth 2-3 and 3-3 are in contact during left lateral excursion. You can mark with the indelible pencils if you want. Trim the incisal edge of 3-3, then repeat the lateral excursions on the right hand side. Now the left and the right lateral excursive movement are smooth without any interference. Finally, check the overall aesthetic, soft tissue support and phonetic. It shouldn't be much difference from your wax trio dentures. Don't forget to give patients post-denture delivery instructions and also denture hygiene care instructions. Review the patients after 1 week of fitting in the dentures.